Welcome to Healthy Focus, the Duke Raleigh Hospital Community Education Series.
Please join me in welcoming Dr. Kevin Speer.
Thank you and welcome tonight. This is one of a series of these Healthy Focus lectures, and I've been privileged to participate in these about once a year. Tonight's talk is going to be on the Age Defying Shoulder, which is a talk geared at more the degenerative shoulder, the older shoulder, obviously. And talk should take about a half an hour or so, and then there's plenty of time for questions and all. So we'll use that format. So welcome. The cultural significance of defying age obviously is all around us, and everyone is overwhelmed. And if you read enough things online or in print media about devices and products to help you defy age, that's a little bit what we're going to talk about tonight, but not in a cosmetic sense in any way, but how to keep the shoulder functioning well as we get older. And within that, having you all have appreciation of why this is needful. You know, what happens to the shoulder as we get older. So aging, anywhere in the body, the medical term is called senescent. So this is called senescent change. It's a reality, it's fundamental, it's biologic, and it's inescapable. Certainly the good news, it's better than the alternative than aging. But the bad news is that soft tissues degenerate, and these involve all the soft tissues in their shoulder, and they're influenced by how old you are, of course, history of wear and tear and injury, of course, and your genetics. So it all is influential. The best example of senescent change that I think is most illustrative is gray hair. You know, that's what a senescent change is. You know, does that mean the person's unhealthy? No. But it means they're probably not 20 anymore. That's all it means. In the shoulder, what happens when you get older, there are predictable things that happen in the shoulder as we get older. One, bone spurs form. Everyone gets a bone spur. I would imagine everyone in this room has bone spurs, at least one in their shoulder. It is just the reality of not being 20 anymore. Tendons deteriorate and tear. Tendons soften. The tendon biology suffers a bit. And as tendons soften, they're less resilient and they're more exposed to injury or harm with certain stressors. Cartilages soften as well. Muscles weaken. Much of that related to age has a lot to do with our biochemical environment, hormones, especially in men, the decreasing testosterone level as we get older. And bone soften. That's an osteoporosis, osteopenia. But that is not what we're talking about tonight. We're talking about everything else, but we're not talking about soft bones, because soft bones don't hurt unless they break. But so what we're talking about tonight, the shoulder, is not osteoporosis. We're talking about bone spurs, tendon degeneration, and all the problems that go from there. Before I start, I'm going to have to give you a brief anatomy lessons. And just stay with me here. It's brief, but I think you need to understand some of the shoulder complexity. So here's, on the left, is a picture of a skeleton of a shoulder, of a body, that is. And this big muscle here on the side is the deltoid muscle. And here's your chest muscle, the pectoralis muscle. If you look from behind, on the right, here's the deltoid again. And this big muscle along the back is called the trapezius muscle. And the big muscle underneath here is called the latissimus. These are the power muscles. When you lift, push, pull, carry, these do the work. These are the power muscles. But this is not where the mischief in the shoulder lies. Here's where the problem in the shoulder lies. It's a deep layer of muscles. The shoulder is unique, and it has two layers of muscles. And these deep layer of muscles guide the shoulder, steer the shoulder, stabilize the shoulder. You know, if you're lifting something heavy, the power muscles are moving the implement or whatever you're moving. But what's keeping the shoulder stable are these deep muscles. And this is called the rotator cuff. It's a hood around the shoulder. And here's the back of the shoulder. There's an infraspinatus, teres minor 2 in the back, 1 on the top called the supraspinatus. And here's the other side here on the right, 1 in the front called the subscapularis. It's a hood of tendons over the shoulder that really comprise about 5 muscles. Here's another cartoon of it. Here's the rib cage. So the shoulder blade is behind the rib cage, and these are the rotator cuff muscles that are deep. This is the biceps tendon, another part of the mischief problem with the rotator cuff. And the reason I put this one up, this little blue structure here is a bursa. Think of a bursa as a little deflated balloon sac. And a bursa exists in the human body anywhere in which there's 2 tissues that have to rub past one another. Because you have to create a relatively friction-free environment. Because if you don't have a bursa, then 2 tissues cannot rub past one another. There'll be friction, there'll be adhesions, there'll be limits, there'll be grating. So the problem in the shoulder is a rotator cuff and spurs, but it is manifested because this bursa gets unhappy, and we'll get into that. So here's, on the left-hand side is another cartoon. Here's the humeral head, that's the ball, the socket's in there. Here's the collarbone above, and here's some sort of spurs that have formed. We all have them. This would be like a ligament over the front. But this is like a bursa. And what happens when you raise the arm up overhead, the bursa gets pinched. And then if you're a little unlucky, the bursa gets inflamed. So here it's depicted as red. This painful bursa is the central source of problems in the degenerative shoulder in terms of pain. It can be painful for numerous reasons, but the centerpiece of the problem is this painful bursa. Then, as bone spurs, on the left, bone spurs continue to form, bursa's inflamed, you get bursitis, you get something called impingement, you get popping and catching. Then if things continue to progress, on the right-hand side here, the rotator cuff tendons start to tear from the spurs. And this is just a continuum, So what makes the shoulder hurt? In the most simplistic terms, what makes the shoulder hurt is that usage exceeds demand. Or usage exceeds supply, meaning that what the shoulder is capable of doing through its physiology, strength, durability, and anatomy, what you've just done exceeds it. And that mismatch is pain. The shoulder doesn't like it. Shoulder starts to hurt. The simple solution, the most simple solution of all the solutions, and we're going to go through a lot of solutions tonight, is really the purpose of the talk, to afford you with some strategies. The simple solution of all, stop doing it. You know, decrease your demand. You know, if it hurts, don't do it. Make a lifestyle choice. Another thing to augment it, just treat the symptoms. You know, do what you're doing, but treat the symptoms. We're talking about medicines, topical treatments, and we'll get into some of that shortly. Decreasing demands on your shoulder, pretty straightforward, pretty simple. Moderate your activities, modify your activities. The credo of letting pain be your guide, or activities as pain permits, is apt. It's very appropriate here. Basically, you're accepting the shoulder as is. So I put this picture up here because if I have someone in this age range who says, well, I'm going to exercise my shoulders or in my chest, I'm going to do push-ups. I'm saying, there are lots of ways to exercise and get tone in your upper chest and in shoulder. This is a bad way to do it, because in a push-up position, you're loading your shoulder, you're putting pressure on the shoulder, and you're just making the rotator cuff, you're squeezing it, you're making it even more unhappy. So this is not a good way to do it. So there are other ways to do it. In the end, you've achieved the same result. But one path of exercise allows you to achieve your goals with minimal problems or pain, and others, it questions you why you even bother to do it. The source of pain in the shoulder is the bursa. Now, there are other sources of pain, like arthritis, but we're not talking about glenohumeral arthritis tonight. We're not talking about shoulder arthritis tonight. Shoulder arthritis is not considered to be an age-related change. I mean, it's related to age. It's more common in older individuals, but it's not a normal, expected physiologic change of aging, not shoulder arthritis. It's genetic, So if it's in your genes, if it's in your family, you're going to get it, but it's not an expected age-related phenomenon like other senescent change. So this bursa here covers the top of the rotator cuff, and the way so that God made the shoulder, the way we're wired up, the shoulder refers pain. So usually with a rotator cuff tendon-based pain, you can have pain in the front and up here, but a lot of times the pain is right here on the side. And so there's only 3 areas in the body that refer pain: the shoulder, the neck, and the back. So like a good example is someone who's got a bad back, herniated disc, arthritis in their low back, and their complaint is their butt hurts. They have pain in their buttock, and they're thinking it's their hip. And their physician might evaluate and say, it's your back. So, well, my back doesn't hurt per se. It's really my hip. So, but yeah, but that's where it refers to. So, but knees don't refer. I mean, if you have a problem in your wrist, it's going to hurt in your wrist. The shoulder can have a referred pain pattern, and that's just a phenomenon of how the nerves are around the shoulder. One brief mention about pain in the shoulder. What we're talking about tonight, remedies, treatment, strategies, and all that, is all this. Second one, the pain that occurs when you use the shoulder in certain ways. This has options. This has a lot of options that we're going to get into tonight. But we're not talking about pain at night. Now, by night pain, meaning in the trying to sleep, pain that distorts your sleep. Now, I distinguish that if you roll your shoulder, it's going to hurt. Of course it's going to hurt, or it could hurt. But I mean at night, you're laying there, you're not rolling your shoulder, and your shoulder still hurt. You have pain at rest, pain at night interferes with your sleep. That's a serious problem. That is not going to be amenable to some of these things we're talking about tonight. So generally speaking, if someone has pain at night, pain that distorts their sleep, they need an evaluation, clinical evaluation. They need to figure out what that is. But generally, if your pain is through activities, pain with use, pain with certain things, and generally speaking, if you've had a reasonable day, if you didn't misbehave during the day, you don't have too much pain at night, that's what we're talking about tonight. The achievable goals, I believe, for the shoulder, and hence the name of the Age Defying Shoulder for the talk tonight, is that the shoulder should not be a limiter of how active and physically fit you want to be. And basically, I think it's possible to keep the shoulder relatively pain-free while you continue to be active. And that's really the goals and the purpose of my talk tonight. Achieving an age-defying shoulder. Much of what I'm going to discuss here, in the end, if you think about it later, you're going, it's all common sense. I mean, it's not orthopedic-based. It's not. Much of this it is common sense. It's not rocket science. I will grant you that. So, regular maintenance and common sense is key to keeping your shoulder fitful and useful as you get older. Good nutrition and sleep. There is abundant literature and a consensus understanding of the importance of nutrition and the importance of restorative sleep. Absent those two things, your biology is not going to support what your psychologically and intellectually what you intend to want to do with your activities and lifestyle and function with your shoulder. There's proper warm-up techniques, proper cool-down techniques that we'll get into, just ways to take care of your shoulder, understanding that the shoulder has to be eased into things as you get older because the tissues are different as you get older. They're stiffer. The biology isn't as good when you're 65 as when you're 25. And the bulk of the research in orthopedics and the great horizon in orthopedics, in medicine in general, at least in orthopedic medicine, is restorative biology. So 10 years from now, I'm not sure there's going to be any better ways substantively for orthopedic surgeons like myself to fix a rotator cuff tear or to reconstruct a shoulder. Not much difference. The difference is how do I make a 65-year-old tendon heal like a 25-year-old tendon? That is the horizon of orthopedic research right now. And that is a tough nut to crack because it's hard to take tissues that have differentiated to revert back to a different state. And then you hear about stem cells and all that kind of research, and that's what's applicable here. But it is very hard to get a good result, a consistent result. The notion that healthy bodies have healthy shoulders. I mean, I have patients, and generally who are unhappy with their shoulders. They have degenerative shoulders. The shoulders ache and they hurt. There's a lot of myofascial pain. Some doctors call it fibromyalgia, and yet that shoulder is housed in a body that is generally unhealthy. It's generally unfit. And I said, you can't have a shoulder that is going to work to what you want to do if your body is generally unfit. Your diabetes is not well controlled. There's no way you're going to get your shoulder consistently better. You have to get your health better. So healthy bodies are needful if you're going to have a healthy shoulder. Good nutrition, obviously important, but I'm a big advocate and believer in, in supplements and antioxidant diets. And the shoulder pain is mediated through inflammation. That's the language of shoulder pain. So anything that's anti-inflammatory has a beneficial effect. Now, how much effect varies. So there's a lot of dietary considerations that can promote that. First and foremost is fish oils, omega-3 fatty acids. That's very real. Some people talk about vitamin C. Glucosamine and chondroitin supplements can help, I think. My experience, based on patients, about 40% of the time glucosamine can help. Antioxidant diets, walnuts, pecans, fish, salmon, blueberries, dark berries, things like that, all can be very helpful. Basically, it's a very healthful diet, but an antioxidant diet can help people whose bodies are prone towards inflammatory conditions. Restorative sleep is so critically important. So critically important. And you need to monitor conditions that rob you of sleep. Medical conditions, basically. Hypertension, the emotional disorders, diabetes, obesity, drugs and other issues. Side effects of prescription medicines. A lot of prescription medicines have those kind of side effects. And once you start distorting your sleep, things start to go downhill in all measures of problems. All measures of problems. I mean, one of the most common reasons that patients cite to me for, say, reconstructive shoulder surgery, say a rotator cuff tear. It's been hurting for a while, it interferes, but they've gotten used to it, they've had some therapy. But the remedy they need relief of pain at night. I'd say it's probably 80% of people. But there's a lot of people that the amount of pain they have during the day, they can deal with it because they really don't want surgery. But it's the pain at night that drives them to seek a remedy because it has such accelerating problems as it influences other things. Certainly sleep apnea, but also musculoskeletal pain, like back pain. Things that can hurt your sleep. It's important to understand that if you can do anything to improve your sleep, the restorative sleep, that you can improve the capacity of your body to be healthier, and shoulders like healthy bodies, or healthier bodies. Regular maintenance exercise, we touched on briefly. We're talking about low weight, high repetitions, less resistance, more repetitions, and with stretching. All of our bodies stiffen a bit as we get older. The shoulder has more motion than any other joint in the human body. It is prone to stiffness as we get older, just through degenerative age-related changes. Then you add some genetics on it, you add some injury on it, it can have all sorts of issues. And all of a sudden, if the back of your shoulder tightens up by 20 degrees, you're going to have more bursitis. So the stiffness causes bursitis, which causes pain too. So it's not just a matter of getting it stronger, which is important. You have to be sure it stays limber. And some people are prone to those kind of problems, especially diabetics. Water exercise is very important. For those of you who have access to water and to pool, especially if your shoulders kind of hurt to exercise, in water, your arm weighs 1/8 of what it does on dry land. So the amount of forces, the amount of strain, in the shoulder is remarkably less in water than it is on dry land. So many times people have an inability to fully exercise well on dry land because of interfering pain. The other clinical solutions they really don't want to pursue, but they want to find some way to exercise regularly, and water is a wonderful adjunct for it. Modalities are helpful to facilitate activity. Heat before, cold after. Some people still ask me that. Heat before, cold after. The heat before is not that common, but certainly I have some people, these are more post-operative individuals, but that they need a warm-up, and some of that's thermal, and so heat helps. Any kind of warm-up can help, but cold after can be very helpful. Cryotherapy is a very useful adjunct in the shoulder, cold therapy. You got to be aware of thermal injury, and generally why I don't recommend, don't use ice bags in the shoulder. Use something like a bag of frozen peas, bag of frozen corn, something that within 20 minutes has warmed up. So some of these freezer packs that stay cold for an hour, that's too much cold on the skin. Now you can put it over a t-shirt and all that, which is fine, but don't underestimate the potential danger of thermal injury. And a lot of times you've gotten some, afterwards you take it off, and generally the skin is kind of red, it's cold. But within an hour, it should be pretty normal colored. If an hour later it still looks kind of red, yeah, you got a little frost nip. You got a little equivalent of a mild sunburn, although not from the hot end, but from the cold end of the spectrum. And the way cold works, it's not, the depth that cold gets into the shoulder, it's not that deep, maybe less than a centimeter. So the rotator cuff is at least 2 centimeters down. So how does it work? It's not like, well, the cold decreases inflammation and it chills the tissues and it slows metabolism. Maybe a little, but that's not really how it works. The way it works is that the way pain is processed by the brain, the phenomenon is called a gate theory of pain. Our brains, the human brain, is easily duped into ignoring noxious stimuli, painful stimuli, if something else comes along with it. So like in the periphery, say in the forearm and hand, the pain fibers are little tiny fibers like hairs. The tiniest fibers are pain fibers. The bigger fibers are vibration, temperature, things like that, position sense. So if you stimulate the same area, like with temperature and with pain, generally what the brain's going to process is temperature. It's how Bengay works. It's how a TENS unit works. I mean, for anybody who's a TENS unit, TENS unit is not making it better. TENS unit tricks the brain into thinking there's no pain there. Tricks the brain. That's how cold works. It tricks the brain. That's how Bengay works. You put it on, oh, it feels so great and hot. Well, that's because that stimulus is better perceived than a pain stimulus. Why medicines help? Because pain is modulated and mediated through inflammation. So you go right to the source. Take an anti-inflammatory medicine. The pain in the shoulder, bursitis, synovitis. So synovitis is inflammation of the joint lining. Unchecked, that leads to frozen shoulders, stiffened shoulders. Bursitis is the issue here. Tendinitis is a little bit just inflammation around the tendons, but bursitis is the main issue. And this is what we're talking about here. So there's the humeral head, rotator cuff would be below here, here's spurs, and this tissue here is all swollen and thick and painful, and it's wicked. And yet, many times, not that, you don't necessarily hurt up here, you might, but a lot of times you hurt down through here. Medicines, the best stuff is over the counter. Ibuprofen and naproxen really works great. I mean, there's a whole litany of anti-inflammatory medicines available. It's like flavors of ice cream. And, which ones are better? Man, they can all work fine. But if you want something simple to use that doesn't require a prescription, try Aleve or try some Advil. I think of the two, if patients ask me, I say I would try some Aleve first, because if Aleve